Welcome to Just One Thing for Parents, where we offer busy parents bite-sized helpful tips for how to connect with and strengthen their relationship with their child. I'm Bettina Hohnen, and today I am joined by the wonderful Tara Murphy, who is a clinical psychologist, and she is an expert in many things, including neurodevelopmental differences and tics and Tourette syndrome. And that's what we're going to be talking about today. So welcome, Tara.
Oh, thank you, Bettina.
So I'm just going to jump in with the question. So my question to you is, what's one thing parents can do to help their child with their tics?
So very interesting and pertinent question. And the key thing about tics is to understand them. That's a term often referred to as psychoeducation. And that simply means just learning about tics and what that means, what they are, good ways to talk about them, what happens to them as they change over time. So I would say my top tip is to access helpful and reliable information about what happens with tics and really for parents to educate themselves so they feel confident.
Wow. So that's really, I wonder if it could be helpful for listeners. A lot of listeners may know what they are, but some may not, just to say a little about what tics are and something about what causes them, how common they are, a few details like that.
Yeah, absolutely. So tics are abrupt, involuntary movements and sounds that are, they're neurodevelopmental. They typically occur in childhood, usually starting between about 5 and 8 years of age, most commonly at about 6. And they fall into 2 different categories. So you can have simple tics, which can either be vocal or motor. So the vocal are sounds that are made usually by the mouth or the nose. The most common one is sniffing. And then you can also have complex vocal tics, which are, as it says on the name, more complex, and they might involve words or phrases or sentences that the person makes. More commonly, there's also motor tics, which are movements, and they can occur anywhere in the body. And similarly, they can be simple. The most common simple tic will be eye blinking, and they can also be complex, which usually refers to several movements happening together in a sequence.
And do kids tend to have one or the other, or would they sometimes have both?
Yeah, really good question. So it's a spectrum, like lots of neurodevelopmental differences. So if you had a very mild tic condition, you might just have eye blinking, and that might just exist for a year or 2 years. And most typically that might be blinking or sniffing, and it would fall into one of those 2 camps, either vocal or motor. At the other end of the spectrum, you have the condition referred to as Tourette syndrome.
Oh, yeah.
And that would be having sounds and movements for longer than a year. And what's really helpful to note is that they change over time. So they typically start with eye blinking and sniffing. Motor tics usually start first, and then vocal tics come on board after a year or 2. And then they change and evolve, usually starting at the top of the body and then working their way down over the years.
Do they get worse?
So they usually peak between about 9 and 13 years of age. And that is when the child will have most tics with the fewest periods of days or weeks without tics. So they're constantly changing. That can be a really distressing time for parents, particularly if they don't have the knowledge that that is the expected natural history or the expected kind of pattern of tics. The positive information that hopefully your listeners will be pleased to hear is that most people grow out of most of their tics.
Okay, right.
So what the research shows is that it's not that they completely grow out of them, but that the impact that they have, the frequency which they occur, and the changing nature of them seems to really slow down for most people.
And I suppose parents might be wondering, is it something I've done?
Yeah, really good question. And I think that sense of responsibility or guilt or, quite concerning feelings that a parent might have is really common. And one of the reasons that I've had parents talk about that is that sometimes they feel it is something that they've done. It's something that they might not have read as yet, that this is actually a genetic condition. It runs in families, and that if a person has that predisposition to having tics, they are always likely to develop them regardless. One other reason that families can often feel guilt or difficult emotions around it is if they didn't realize that they were tics, for example, a sniffing tic or an echolalic tic, where a child was repeating a word and they kept asking the child to stop doing the tic. And without the knowledge that it's more or less an involuntary sensation that the person does in response to an urge that's particularly involuntary. So hopefully that's a helpful message for people to hear, that it's not uncommon for a parent to repeatedly ask a child to stop a movement or sound. But I think for most families, once they realize that it is involuntary, they realize that it's helpful not to comment.
Okay. That's so helpful. So your one tip, obviously it's always so hard in this podcast that I've set up as just one thing. It's really hard to say one thing, but if you had one thing, you're saying psychoeducation, learning what it is, knowing everything about it is your number one thing for parents and for children?
Yes, absolutely. And that information comes in a way that's highly accessible, because I think parents probably need one level of detail, and then depending on the age of the child, whether they're 6 or 16, accessing information that's relevant to them and placed at a level that they can understand, and also feel that empowerment.
Yes. So the reason that helps is because it lowers any shame or guilt. It empowers you to know what it is. Is that right? Anything else?
Absolutely. It also enables you to explain to other people.
Right.
So it might be teachers at school, it might be grandparents, it could be the post person. Having that information, being able to respond to questions, because the thing about tics is that they're visible, but I see it as being armed with that material really is a form of empowerment for the person themselves and their family.
Absolutely. I read somewhere, just to sneak in another tip, but I read somewhere, create a world where there are no reactions. I read it was called a tic neutral environment. Is that correct?
And also to say for people in a tic neutral environment, a response, we all respond to movements and sounds in our environment. So if you are a teacher as well as a parent, or you encounter children with tics, and you can't help responding if you hear, that's okay. It's about doing that with acceptance and kindness and curiosity if you did have a question to ask them. But I think that the tic neutral environment is certainly very helpful.
And that means not giving it too much attention, allowing it to be there in a non-judgmental, compassionate way.
Yeah. And also allowing the child, should they want to discuss it or discuss any element of it, allowing the possibility that, that is a comfortable thing to do. And I think if you ask what can make this difficult for families, it's about that judgment of not wanting to check in with the child because their tics might be upsetting to the parent, for example, but also giving the space to the child to be able to talk about it when and if they do want to, or if they're struggling with a particular aspect. Things like pain are quite common. Stigma, unfortunately, is also common in adolescence. So it's about striking that balance, I think.
Yeah. So I wonder if we could just finish. I think parents find it helpful just to hear about maybe a case, a family maybe you've worked with where the parents' actions have really helped them in managing their tics.
Thanks, Bettina. I do a lot of behavioral therapy for tics, which is a form of intervention which can help the child gain better control and management over their tics. And it's really key that it's the child who makes a decision on whether this is going to be a valuable tool in their toolkit for coping with their tics. And particularly with younger, pre-adolescent young people, I can think of a case that I've recently been working with where the parents have been involved in every therapy session that we've been using this model in which the child develops an awareness of their tics and how to manage them. And as we know, one of the key things with treatment is not so much what you do in the session, but how you use the tools that you learn in between the sessions, how you do the practice. And although there's one family I have in mind, I would say this admiration and appreciation goes out to many families who support their children in using the skills, overcoming a parent's own anxiety about that, and really, supporting the child to do the practices, enabling them to explain to other unknown people, unfamiliar people about what their tics are, and really enriching that toolkit of enabling the tics just to be a very small part of their life. And for me, that toolkit serves the child not just at that point, but as they mature and, secondary school, university, should the tics remain something that they need to continue to work on. Getting parents involved can be hugely helpful.
Yeah, and I love that idea that it's only a part of them. It's a tiny part of them. It doesn't define everything about them. Tara, thank you so much for your time and for your wisdom. So for those of you who are watching on YouTube, you'll see there's a book here. Tara and I wrote this book together, actually, The Incredible Teenage Brain. And so do look that up. And Tara's also written a couple of books about tics and Tourette's, haven't you?
I have done. Maybe I can give me the names.
Yes, and I can put them in the show notes. Thank you so much, Tara.
Thanks a lot, Bettina, and thanks everyone for listening.